This is Anya, and Anya has a recurring back problem, and I've given her many adjustments and haven't been able to get to the exact point yet, but we're going to try again, and we're going to see what her weaknesses are. So when I test her, she tests very strong. In fact, on a table, I can't find anything. Whether she's face up or face down, her legs are even. Chiropractically, she tests out very good. We can give her adjustments. Within 3 days, the problem comes back again. So what we're going to do is we're going to do a few dynamic tests to see if we can locate the real cause of the problem. I'm going to ask her to bend over, touch her toes, and come back up. She goes totally weak, completely weak. So we know that the problem will be exposed through bending. So what we want to do is there a torque involved? We don't know. So I'd like her to bend and touch that hand to that foot and see what happens. Very strong, I can't budge her. Let's try the other way. So she has a torque within her spine slightly to the right. So every time she picks up something, ties her shoes, whatever she does, she goes weak. But on a chiropractic table, she's not weak, we can't find the problem, and it's just become therapy. And therapy is not really healing. Okay, so what we have to do is figure out what could possibly do this. So bend over again, touch your toes, come back. Now we have her weak, spread your feet a little bit. And I'm going to see if it's coming from the pelvis or L5. That would be normal thought. It doesn't seem to be doing any of those things. So this would be a rather confusing thing. Okay, put your head this way. Put your head way back. Put your head way back over there. Put your head over here. Put your head here. And put your head here. Wow, she goes very strong like this. So if she walked like this all day long, she would be really well in the back, but her neck would start hurting. Okay, so now what we have to know is where is the problem? Okay, so do not move. I'm going to get my instrument and we're going to try. Drop your arm. And what I'm going to do is I'm going to adjust her brainstem using this instrument. And this is affecting her atlas, the first bone in the neck that holds the head up place. Okay, we don't know if that worked or not, but we're going to give it a try. Go down. No, that was the strong side. Do both. Wow. Okay. Very, very strong. So what did we find? That she had an upper cervical problem. Now imagine a 1 ounce little bone has to hold a 10-pound ball of weight. And in certain positions, her body was having trouble holding that 10 pounds, and the resultant stress was really going into her mid-back and her right in the center of the back, not the low back. And so she ends up developing a lot of stress because her head is heavy and is not balanced. So this was a perfect upper cervical adjustment. And this will last unless she bumps her head, gets in an auto accident, falls down, trips. This will last and doesn't have to be done again. And we could treat other things next time.
Thank you.